Hi, I'm Dr. Messina. Today we're going to be discussing 5 things that you should not do the day you get your Botox. Same thing for Dysport. Same rules apply. Number 5. No heavy exercise that day. Whereas Botox and Dysport are already known to decrease and treat migraine headaches, for some reason, should you participate in heavy athletics that same day, or heavy exercise for that matter, you can develop a headache afterwards. So I usually tell my patients, the day we get the Botox, just have a day of relaxation. Number 4, placing your head in a downward position. I'm talking specifically about doing something like the downward facing dog position in yoga. You might think, okay, I'm not going to do heavy exercise, I'll do some relaxing, stretching, healthful yoga. By placing your head in a downward position, you can change the blood flow, which can possibly make more risk of getting a headache and even possibly moving the Botox or Dysport to another location, a location that wasn't the desired location at the time of injection. Number 3, icing the area. Some people come in and they might put an ice pack on their forehead to make the skin a little numb before getting the injections. Now really, I don't really encourage that. The reason why is the needles I use are very, very fine 31 gauge insulin needles, and they don't hurt all that much to begin with. But if you want to ice before getting the Botox, that's just fine. However, afterwards, you don't want to. Botox and Dysport are both very delicate molecules. So if you make them too cold, you can decrease the effectiveness of both of them. So you might get an ineffective injection, or you might get a result that just doesn't last the proper amount of time. Number 2. Now, number 2 and number 1 almost go hand in hand. When you get a Botox injection, your injector is putting a specific dose into a very specific place, either between the eyes or around the eyebrows or across the forehead, even on the crow's feet. When I inject my patients, I mark them with a little white grease pen. I do that so I know exactly where I'm injecting it and specifically picking that muscle. And I want that Botox or Dysport to be injected right into that spot, and I want it to stay there and get absorbed through that spot. So number 2 will be having any type of eyebrow waxing the same day as you get your Botox or Dysport. Now chances are within 4 hours, your Botox and Dysport is gone from the injection site and it's to the neuromuscular junction where we want it to be. In any event, I tell my patients it's better to be safe than sorry, and I would tell them to wait at least 24 hours before getting any type of eyebrow waxing. And number 1, the big number 1 no-no after getting Botox or Dysport would be rubbing or massaging between the eyes and on the forehead. After your injection of Botox, it should all be sub-Q. Some of the injections are intramuscular and you don't see them, but the majority of Botox injections should be placed subcutaneously. So you might see a little bleb, or like a little mosquito bite afterwards. Sometimes patients want to start massaging them. I'm right there at the time and I tell them, no, don't do that. But afterwards, when you go home, it's important not to start rubbing your forehead or rubbing between your eyes. The reason why is, like I said before, we have the injections placed in a specific spot. By putting pressure on it and massaging it, you can move that Botox or Dysport to a spot that's really not where you want it to be. On the forehead is not a big deal. The injections that are around the eyebrows, however, are very close to the upper eyelid. And should you push it into the upper eyelid, you could get what we call an eyelid drop or a ptosis. And it's quite bothersome because you have a half-closed, even a full-closed eyelid that there's really very little you could do with to correct it, and it's going to stay that way for a number of weeks. So no massaging of the forehead, at least for that day. Now here we have 2 little freebies. How about putting on makeup, and how about having a little wine? Technically, wine decreases platelet activity. However, it's not like taking an aspirin or it's not like taking a full-blown anticoagulant like Eliquis. So yes, it might slightly decrease your platelet activity and slightly increase the risk of you getting a tiny bruise. But if you want to have a glass of wine after your Botox, that's just fine. And now how about makeup? Again, I tell people you can't put makeup on. Give it about 3 or 4 hours after your injection and gently put it on. For two things. Even if you put it on gently at the time of injection, you do have a tiny opening in the injection site. The potential, a very small potential, of getting an infection. And when you put the makeup on, just be very gentle just for that day. Well, I hope you learned something from this, and if you enjoy the videos, remember, help me out, click subscribe, hit the little bell to be alerted for the future videos.